Good morning. I am Dr. Manish Singhal, Associate Professor, Department of Plastic Surgery, Mahatma Gandhi Medical College and Hospital, Jaipur. Today I am going to brief on the topic wound healing. Wound healing is restoration of the tissue continuity, where wound is defined as a separation or discontinuity of the skin, mucous membrane or tissue caused by physical, chemical or biological insult. Wounds can be classified in various ways. In one type, closed wound or internal wound is a wound where only the deeper tissues bearing the skin or mucous membrane are damaged. That means skin and mucous membrane are intact. In open wound, there is discontinuity in the skin and other covering tissues. According to the type of injury, wounds can be classified into incised wound, where it is caused by a sharp cutting instrument with minimal loss to the tissue. Edges are regular, bleeding is present, it's painful, it can heal by primary intention. For example, sharp cut by a knife. Lacerated wound is caused by tearing of the tissues, where wounds have irregular jagged borders. Loss of tissue is limited to the skin and the subcutaneous tissue. For example, a barbed wire. A penetrated wound, which is caused by sharp pointed objects like nails. There is a small opening, it can be very deep, and infection or foreign particles can be present in the wound. Opening is inadequate for drainage, so it is like a punctured wound due to a nail. Perforating wound. It has two openings, one entrance and another exit. These are deep wounds which communicate with the cavities like abdominal, thorax or joints. For example, gunshot wounds, stab wounds. Contusion or bruises. These wounds are produced by blunt objects when damage to the subcutaneous tissue occurs without breaking the continuity of the skin surface. These may be classified on the degree of damage into first, second and third types, where it can be mild degree of contusion or according to the rupture of capillaries and ecchymosis and then presence of hematoma as the severity increases. Operative wounds can also be classified on the basis of microbial contamination, which may be clean wound, which is elective, not an emergency type, non-traumatic, which can be closed primarily without any acute inflammation. There is no break-in technique or respiratory GI tract or any other cavity is not involved. Clean contaminated wound, where any emergency case or elective opening of the respiratory or GI tract with minimal spillage. Contaminated wound, which is having non-purulent inflammation, where there can be spillage from the GIT or biliary or genitourinary tract and presence of infected bile or urine may be there. Penetrating trauma, which is less than 4 years old, or chronic open wounds, which need coverage. Another type is the dirty wound, where purulent inflammation, for example abscess, may be present. There might be perforation of the respiratory GI tract or the biliary tract, and penetrating trauma is more than 4 years old. There are wound scoring systems. One of them is a sepsis system, where the wound is graded according to the wound characteristic, presence of serous or purulent exudate, presence of erythema and separation of deeper tissues. Other multiple criteria are there, in which wound is classified and given scoring from 0 to more than 40 according to the degree of wound. Another type of classification is the Southampton wound scoring system, where there are grades from 0 to 5, where in the beginning from normal healing with mild bruising, erythema and increasing signs of inflammation, presence of discharge and then pus, and deep wounds with hematoma classified as type 5. Wound healing may be classified into 5 types. First, primary intention, secondary intention, tertiary intention, mixed intention, and healing under scab. Healing by first or primary intention involves epidermis and dermis without total penetration of the dermis, where healing is by the process of epithelialization. Wound edges are brought together so that they are reapproximated. Minimal scarring is there. Most surgical wounds heal by primary intention within 14 days. Wound closure can be performed with sutures or tapes or staples. For example, well-defined lacerations. Healing by secondary intention, when large wound is allowed to granulate, Surgeon packs the wound with gauze or drainage system, and granulation results in broader scar. Healing process is slow as there is some drainage present from the infection. Wound care has to be done daily to do complete removal of the wound debris and allow for granulation tissue formation. Healing takes about 2 to 3 weeks. Third or tertiary intention healing involves delayed primary closure or secondary suturing, where the wound is initially cleaned, debrided, and observed for 4 to 5 days before closure. Then this wound is purposely left open. For example, healing of the wounds by the use of grafts. Healing by mixed intention, where wound healing is done first by primary intention and partly by secondary intention. When it happens when sutured wound has been partially disrupted. Healing under scab. Here, in superficial wounds like abrasions, where there is exudate present and wound dries and forms a scab, then granulation takes place under the scab, and after some time, when granulation is complete, scab falls off automatically and wound heals. The basic mechanism of wound healing involves presence of tissue injury, after which platelets coagulate around the wound. Inflammatory process starts with accumulation of lymphocytes and macrophages. Along with fibroblasts, these mediators cause collagen lysis. New vascular growth occurs, which causes collagen synthesis, and fibroblasts cause wound contraction. All these processes, along with epidermalization, cause collagen remodeling, and healing of the wound occurs, along with the support of proteoglycan synthesis. Factors that affect wound healing can be surgical, anesthetic, or patient-related. Local factors can be surgical issues involving the vascularity of the tissue, mechanical stress, movement, shear, foreign body presence, edema, dehydration, local irradiation, suture material used, and presence of wound infection. All these factors will delay wound healing. Similarly, the systemic factors like increased extremes of age, mostly increased age, obesity, malnutrition, vitamin deficiency, anemia, hypoxia, systemic diseases, these all will lead to delayed wound healing. These have to be taken in consideration of the wound healing. So that was in brief about wound healing. Thank you.